Joining us now is Dr. Tom Frieden, the former director of the CDC. He's now president and CEO of Resolve to Save Lives, an initiative working to protect people from cardiovascular disease and prevent epidemics. Dr. Frieden, thank you so much for being with us. We appreciate it. You know, we just heard from Meg. I think this is so confusing for parents. You hear that hospitalizations are up. You hear the new CDC guidance. If you have little kids, you're wondering what to do with childcare. What advice do you have?
Well, first and foremost, get vaccinated, and if it's time, get boosted. We're going to be talking about whether you're up to date with your COVID vaccinations. And as we learn more, what that means may change with time. But vaccination is by far the most important thing that we need to do. Also, what your correspondent just covered is very important. We all need to work together to keep kids in school and learning. And we can do that by vaccinating, boosting, and masking up.
So, Dr. Frieden, you'll agree that this is sort of confusing for a lot of people because the CDC is now saying Americans who test positive for COVID can stop isolating after 5 days if they no longer have symptoms, but they should still wear a mask. What do you think prompted this move? Because I suspect that there will be a lot of people who will see this guidance and wonder what this really means and what this has meant over the course of the entire pandemic.
Here's the bottom line. The virus is adapting. Omicron is different, very different from prior strains, and we need to adapt too. So appropriately, the CDC is adapting their guidance for the current situation. They're doing so in real time. We wish we knew more. We wish we knew how severe Omicron is going to be, but we won't know that for a few weeks. We wish we were able to protect kids under age 5, but currently we don't have a vaccine for them. That's why it's so important that everyone 5 and over get vaccinated and boosted to protect all of us. Remember, over 50 American kids have been killed by COVID so far, and thousands have suffered from the inflammatory condition that rarely follows it, but can be quite severe and life-threatening. We all need to work together, and if we do that, we can prevent COVID from dominating our lives in 2022.
Dr. Frieden, you mentioned being boosted. Now, the CDC says individuals that have received their booster shot shouldn't need to quarantine. So if that is the case, then them wearing a mask for 10 days around individuals, is that enough time, or do they need to wear a mask after that?
10 days is a conservative amount, and frankly, anytime you're indoors with a lot of other people, mask up. It protects you and it protects others around you, especially where Omicron is spreading a lot, and especially if people there or people they have contact with are older or have weakened immune systems. Masks are a very small price to pay to keep our economy moving, keep our schools learning in person, and save lives.
I think there's a lot of questions about testing, too. I know a lot of people who got their positive test. They now hear these new guidelines. Part of the guidelines is not to test negative out of this. One expert calls that reckless. Should a negative test be part of this 5-day new rule, or what do you think about this?
The CDC does say that if you've been exposed, best practice would be to test at 5 days before leaving quarantine. But, you know, CDC makes guidance and recommendations in the real world, not the world that we wish existed. And right now, there aren't enough tests. And furthermore, the data suggests that with Omicron, you're most infectious a day or two before you get sick, and for the first day or two after you've gotten sick. So it's a reasonable approach to keep our economy moving, save lives, and be practical in a way that we can make sure that COVID doesn't dominate our lives and the lives of people around us through 2022.
That is certainly the wish. Dr. Frieden, thank you so much for the clarity as always. We appreciate it.
Thank you.